Wherever people go, illnesses and injuries are sure to follow. An aquatic environment is no exception.
On any given day, you might have to care for anything from minor cuts and scrapes to a breathing emergency or heart attack. Part of your job as a professional lifeguard is to care for medical emergencies that occur in your facility. So you need to learn some essential CPR and first aid skills.
We'll show you how to recognize the signs and symptoms of different types of illnesses and injuries, and we'll also show you how to care for them.
Like rescue skills performed in the water, CPR and first aid skills require frequent review and practice, and it's well worth the effort, because when you know CPR and first aid, you know how to save a life.
Hi Johnny, are you okay? Did you hurt yourself? Fall down?
As a rescuer, there will be times when you come into contact with blood or other body fluids. Although the risk of getting a disease while providing care is low, you need to know how to protect yourself and others from blood-borne pathogens and other diseases. Blood-borne pathogens are bacteria and viruses present in blood and body fluids, which can cause disease in humans. The diseases of primary concern to professional rescuers are hepatitis B, hepatitis C, and human immunodeficiency virus, also called HIV. These diseases are spread primarily through direct or indirect contact with infected blood or other body fluids. To prevent the spread of blood-borne pathogens and other diseases, it is important to treat all body fluids and substances as infectious. You can prevent the spread of blood-borne pathogens and other diseases by following standard precautions. These include use of personal protective equipment, hand hygiene, engineering controls, work practice controls and proper equipment cleaning procedures, and spill cleanup procedures. Personal protective equipment includes all specialized clothing, equipment, and supplies that keep you from directly contacting infected materials. This includes breathing barriers, disposable single-use gloves, and other protective coverings. When giving rescue breaths to a victim, use breathing barriers, such as resuscitation masks, and bag valve mask resuscitators. Wear disposable gloves when providing care, particularly if you come into contact with blood, body fluids, or other potentially infectious materials. In addition to disposable gloves, wear protective coverings such as a mask, eyewear, and gown whenever you are likely to come in contact with blood or other body fluids that may splash. It is important to use and remove gloves correctly. Here is one method used to remove soiled gloves. Partially remove the first glove by pinching the glove at the wrist. Be careful to touch only the glove's outside surface. Pull the glove inside out toward your fingertips without completely removing it. The glove is now partly inside out. Next, remove the second glove. With your partially gloved hand, pinch the outside surface of the second glove at the wrist. Pull it toward your fingertips until it's inside out. Then remove it completely. Next, grasp both gloves with your free hand, being careful to touch only the clean interior surface of the gloves. Discard soiled gloves in an appropriate container, such as a biohazard bag. Always wash your hands after giving care. Wash your hands thoroughly with soap and warm water for at least 15 seconds. By washing your hands frequently and thoroughly, you wash away disease-causing germs that you may have picked up from other people, animals, or contaminated surfaces. To review. Blood-borne pathogens such as hepatitis B, hepatitis C, and HIV are spread primarily through direct or indirect contact with infected blood or other body fluids. Following standard precautions is an approach to infection control that considers all body fluids and substances as infectious. Avoid contact with blood and other potentially infectious materials. Use personal protective equipment such as disposable gloves and breathing barriers. Thoroughly wash your hands with soap and warm water after providing care. These are some of the most effective ways to safeguard yourself, your fellow rescuers, and victims against disease transmission.
As a lifeguard, there may be times when you need to breathe for victims who cannot breathe for themselves.
1,000, 2,000.
To help prevent disease transmission during rescue breathing, use personal protective equipment such as disposable gloves and resuscitation masks. Although resuscitation masks vary in size and shape, they should have the following characteristics. They should be easy to assemble and use. They should be made of transparent, pliable material that allows you to make a tight seal over the victim's mouth and nose when performing rescue breathing or giving emergency oxygen. They should have a one-way valve for releasing exhaled air and a standard 15mm or 22mm coupling assembly, which corresponds to the size of the opening for the one-way valve. They should have an inlet for delivering emergency oxygen. And they should work well under different environmental conditions such as extreme heat or cold. Pediatric masks are designed for use with children and infants.
To use a resuscitation mask, first assemble the mask. Attach the one-way valve. Kneel behind the victim's head. Place the rim between the lower lip and chin and lower the mask until it covers the mouth and nose. Place your thumbs along each side of the mask and slide your fingers into position behind the angles of the victim's jawbone. Seal the mask by applying downward pressure with your thumbs. To open the airway, lift the jaw and tilt the head back. Then breathe for the victim. The one-way valve opens to let your breath pass through the victim and then closes to prevent the victim's exhaled air and body fluids from contacting you. This reduces your risk of disease transmission. There will be times when you may want to position yourself to the victim's side. To use a resuscitation mask in this position, kneel next to the victim's head. Position the mask to cover the victim's mouth and nose. And with your top hand, place your thumb and fingers around the top of the resuscitation mask. With your other hand, slide your first two fingers into position on the bony part of the victim's chin. Apply downward pressure with your top hand and your thumb of your lower hand to seal the resuscitation mask. To open the airway, lift the chin and tilt the head back. Then breathe for the victim. To give rescue breaths, you may choose to use either position, to the victim's side or behind the head. 1,000. Use a pediatric resuscitation mask on an infant. Seal the mask and give rescue breaths in the same manner as you would for an adult. If a pediatric mask is not available, you can use an adult mask. When using an adult resuscitation mask on an infant, always follow the manufacturer's instructions. Kneel behind or next to the infant's head. From behind the infant's head, rotate the mask and position the nose of the mask on the infant's chin. Lower the wide end of the mask to cover the infant's mouth and nose. Place your thumbs along each side of the mask and slide your fingers into position behind the angles of the infant's jawbone. Seal the mask by applying downward pressure with your thumbs. To open the airway, lift the jaw and tilt the head to a neutral position. Then breathe for the infant.
To review, to use a resuscitation mask, assemble the mask, position the mask, seal the mask and open the airway, then breathe for the victim.
1,000, 2,000, 3,000.
As a professional rescuer, you will be expected to care for injured or ill victims. Before giving care, size up the scene. Check the scene for safety. Try to determine the mechanism of injury. the number of victims, and what additional help you may need. If the scene is safe, approach the victim and prepare to give care. Put on the appropriate personal protective equipment before you come in contact with the victim.
Hey, what happened?
I fell. My arm's probably broken.
Perform an initial assessment to identify any life-threatening conditions. Check for consciousness. If the person is conscious, obtain consent before providing care.
I'm trained in first aid. Can I help you?
Checking for consciousness may be as simple as talking with the victim. If he is able to speak to you, you know he is conscious, breathing, and has a pulse.
Does your head hurt? And your legs? Your arm's the only thing that hurts.
1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000.
But if a victim appears to be unconscious, tap and shout to check for consciousness.
Sir, are you all right?
If the
Sir,
victim does not
are you all right?
respond,
Can you hear me?
you have implied consent to continue care.
Tina, call 911. We have an
Summon
unconscious
EMS
patron.
personnel by calling 911 or the local emergency number and continue with the initial assessment. If the victim is face down, roll him carefully onto his back. Position yourself so you're facing the back of the victim's head. Move the arm that is closest to you up next to the head. Place one of your hands at the back of the neck and your other on the hip. Gently roll the victim toward you, keeping the head, neck, and back in a straight line. Once the victim is on his back, check for signs of life. Open the airway by tilting the head back and lifting the chin. Put your ear close to the victim's mouth and nose and check for signs of life. Look for movement and look, listen, and feel for normal breathing for no more than 10 seconds. Breaths that are irregular, gasping, or shallow may not provide enough oxygen to the body. These are called agonal breaths and should not be confused with normal breathing. If there is no movement or breathing, give 2 rescue breaths. Position your resuscitation mask over the victim's mouth and nose. Seal the mask, open the airway, and breathe into the mask. Each rescue breath should last about 1 second and make the chest clearly rise. If the breaths make the chest clearly rise, remove the resuscitation mask and check for a pulse. To find the carotid pulse, place one hand on the victim's forehead to maintain an open airway. Place 2 fingers from your other hand on the front of the victim's throat. Then, slide your fingers toward you and down into the groove at the side of the neck. Press in lightly to feel for the pulse.
2, 1,000,
Feel for a pulse for no more than 10 seconds.
6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000.
Quickly scan